viewers, I'm Tiberiaus, a student from Mamref International University, ready to present you a talk on hypertension. Hope you learn and enjoy. Welcome and let's go. Hypertension or high blood pressure, it occurs when a sustained elevated systolic pressure is greater than 140 millimeters of mercury, and all when a sustained elevated diastolic pressure is greater than 90 millimeters of mercury. Main types of hypertension. We have number 1, essential, which is primary hypertension. Number 2, non-essential or secondary hypertension. Number 3, we have malignant hypertension. And number 4, we have hypertensive urgencies. Under the blood pressure classification, blood pressure can be classified according to the normal ranges of blood pressure in a normal human being. Pre-hypertension, stage 1 hypertension, and stage 2 hypertension. Under normal, the normal values should range from a systolic of 120 of less than 120 and a diastolic of less than 80. In pre-hypertension, it should be 120 to 139, 80 to 89. In stage 1 hypertension, the systolic pressure should be from 140 to 159 and a diastolic pressure of 90 to 99. Stage 2 hypertension should be from greater than or equal to 160 millimeters of mercury and diastolic of greater than or equal to 100. Under the same thing, under hypertension, we're going to look at the pathophysiology of hypertension. As we know, blood pressure is a product of cardiac output and peripheral resistance. And peripheral resistance can be affected by the diameter of the blood vessels and blood viscosity. Also, it is affected by other factors, mainly vasoconstriction, arterial narrowing of the peripheral blood vessels due to factors like atherosclerosis, and RAS. All these factors lead to vasoconstriction, thus increasing peripheral resistance, causing hypertension, which presents with symptoms like blood fission, headache, angina, and palpitations. As we know, hypertension has its own causes. So, direct we go to causes of secondary hypertension. We have kidney disease, congestive heart failure, we have diabetes, head injury with increased intracranial pressure. There are so many, but we decided to take the 4 of them because they are the main causes of secondary hypertension. On the other thing, diagnostic tests for hypertension. So we have FPS, creatinine clearance, doing PAN, that's PUN, that's blood urea nitrogen, and some more diagnostic tests. On management, number 1, patients who have hypertension, they should be managed properly. Number 1, we start from the medication. Patients having medications, they are supposed to, number 1, use of diuretics, e.g. group diuretics such as Lasix, whereby we give a dose of 40 milligrams once a day, or OD. Number 2, we can use ACE1 and ACE2 inhibitors, that's angiotensin converting enzyme 1, angiotensin converting enzyme 2 inhibitors, e.g. captopril, 25 milligrams per hour twice a day, or PD. Number 2, patients with hypertension should limit the intake on calories. Number 3, increase potassium intake in diet of a patient on HTN, so that as well as magnesium and calcium. Reduce sodium intake in a patient with hypertension to reduce the fluid retention in the body. Thank you for watching. That's our presentation and ready for the next one. Please don't remember to subscribe and we love you. Bye. Enjoy.